The following is a general surgical technique video for the Stabilink MIS interlaminar spinal fixation system and is intended for illustrative purposes only. As with all surgical procedures, the technique used in each case will depend on the surgeon's medical judgment as to the best treatment for each patient. Detailed preoperative clinical and diagnostic evaluation followed by carefully executed surgical technique is essential. Only those individuals with specialized training and experience in spinal surgery should use the Southern Spine Stabilink MIS interlaminar spinal fixation system. Refer to the product instructions for use for a complete description of indications, contraindications, warnings, cautions, and other information about the system. The patented Stabilink MIS interlaminar spinal fixation system is a posterior, non-pedicle supplemental fixation device intended to provide stabilization in the thoracic, lumbar, and sacral spine, T1 through S1. It can be used as an adjunct to interbody and/or posterolateral fusion. It is essential to use the implants with their specifically designed instruments. Refer to the product instructions for use and surgeon's guide for a more complete description of indications, contraindications, warnings, cautions, and other information about the system. The unique Stabilink MIS interlaminar spinal fixation system is comprised of a single set of instruments and implants, therefore taking up minimal room on a sterile operating room stand. There are multiple implant configurations to accommodate almost any anatomical situation. The dual lamina, easy lamina, C2 base, and C3 base, as shown here. Position the patient in the prone position on the operating table. Identify the spinous processes at the appropriate level using intraoperative imaging. Create a midline incision 2 to 4 centimeters in length to expose the spinous processes at the appropriate level. Elevate the paraspinal muscles and other soft tissue to properly expose the spinous processes and lamina to the medial border of the facet joints. According to the surgeon's technique preference, the supraspinous ligament may be left intact, reflected, or removed completely. Ensure that the implant site is completely clear of connective or soft tissues, lightly decorticating the fusion area. If the ligament is left intact, insert the universal rasp with the ratchet arm in the down position into the appropriate level between the spinous processes and puncture the interspinous ligament, placing it as far anterior as possible. Lifting the ratchet arm slightly and using slight squeezing pressure, slightly rotate the universal rasp, cephalad, and caudad to ensure full insertion into the interspinous space. Using a tactile feedback with the ratchet arm in the down position, determine the implant size. Choose the appropriate Stabilink implant size to best match the bony anatomy, with the ultimate goal of placing the implant as far anterior as possible. Do not overdilate the interspinous space. Excessive force may lead to fractures of the spinous processes. Once the appropriate implant size has been determined, the universal rasp can be rotated cephalad and caudad in order to decorticate the spinous process. Optional aggressive rasps are available to further decorticate and open up the interspinous space prior to placement of the Stabilink implant. It is important to make sure that the implant set screw is present in the lock plate and the set screw bottom is flush with the open slot surface. As you can see, the set screw is a little proud. Using the set screw driver, adjust the set screw to be flush with the open slot surface. Now, the tray easily passes through the lock plate as shown. The patented precision-guided PG inserter compressor is a separable instrument. In order to implant the Stabilink construct separately, for example, one piece at a time, the instrument should be disengaged. To disengage the arms, press down on the thumb lever above the circular pivot joint and separate the arms. The arms will disengage and separate. Load the tray plate side marked with a single dash onto the correspondingly marked hex screw of the PG inserter compressor. Finger tighten the hex screw into the tray plate. Load the lock plate side marked with two dashes onto the correspondingly marked hex screw of the PG inserter compressor. Finger tighten the hex screw into the lock plate. When fully attached, the lock side marked with two dashes can rotate up to plus or minus 10 degrees to accommodate the anatomy. Insert the tray side of the implant along the spinous processes, with the tray centered in the space between the spinous processes, carefully positioning it into the interior position. Insert the lock plate side of the implant into the surgical site while lining up the pivot joint in the middle of the PG inserter compressor and aiming just past the end of the tray so that the slot can engage the tray. Engage the second arm into the first arm of the PG inserter compressor until it engages securely and locks into position. You will hear a click when fully seated and engagement occurs. If the surgeon has elected to remove the interspinous ligament, the implant can be placed with the PG inserter compressor assembled as shown here. If the tips of the spinous processes are too close, you can simply rotate the implant into position as shown here. Carefully lift the ratchet in order to begin compressing the arms of the PG inserter compressor. Carefully increase the pressure to ensure that the implant spikes are properly seated into the spinous processes or lamina. The knob on the threaded ratchet arm can be turned clockwise to increase compression. Do not overcompress the implant. Excessive compression may lead to fractures of the spinous processes. Visually confirm that the implant spikes are fully seated in the bone, with proper apposition against the spinous process or lamina. To ensure that the set screw is located over the tray for locking, at a minimum, compress the handle until it at least covers the black square for the regular 23 mm tray, and at least covers the black triangle for the short 18 mm tray on the threaded ratchet arm. It is important to always visually confirm that the tip of the tray is visible past the locking plate to ensure that the set screw will properly engage the tray. Confirmation of the implant alignment can now be performed using X-ray or any other image guidance tool as necessary. Load the torque driver into the torque handle as shown. Ensure that the driver shaft is engaged with the handle. This can be verified by pulling on the shaft. Do not use the gray removal handle for locking the set screw. Place the torque driver assembly into the PG inserter compressor shaft in the cannulated opening in the lock side of the construct. The driver will guide itself into the lock side of the implant and into the set screw as shown. Tighten the set screw clockwise until the torque handle clicks twice. Once the set screw is tightened to specification, remove the set screw driver. Final confirmation of the implant placement can be made with the appropriate imaging tools. Disengage the PG inserter compressor by lifting up the ratchet arm and then completely loosening the hex screws on each side of the implant with the hex driver and remove from the surgical site. The Stabilink MIS interlaminar spinal fixation system has been shown to provide increased stability in all three planes: flexion extension, lateral bending, and axial rotation when compared to similar devices. The Stabilink MIS interlaminar spinal fixation system can be easily removed if necessary. Attach the gray removal handle to the torque driver. This can be verified by pulling on the shaft. Insert the removal handle assembly into the set screw of the implant to remove. Do not use the black torque handle for removing the set screw. Use the removal handle assembly, turning counterclockwise to loosen the set screw. Carefully separate the lock side from the tray side with a cob elevator or similar instrument and remove the implant from the surgical site. If the ligament was removed and bone graft material packed into the space, take special care not to disrupt the fusion mass if it is desirable to keep it intact. The Stabilink device can be used with bone graft material. If performing an inner body fusion, disc preparation and inner body spacer placement are typically performed prior to placement of the Stabilink device. If not previously performed, decorticate the bone surfaces, prepare the fusion site for grafting, and place the bone graft material in the usual manner. If the supraspinous ligament was resected, bone graft may be packed posterior to the device between the tips of the spinous processes. The anterior tray design creates the perfect containment area while protecting the dural space. If fusing through the facets, decorticate articular surfaces and place bone graft in the usual manner. If desired, additional posterior bone grafting material may be placed around the implant, in the posterior lateral gutter, and/or across the interlaminar space. After the construct is implanted and bone graft completed, close the surgical site using standard techniques. If the supraspinous ligament was reflected, it may be sutured back to the tips of the spinous process. The fascia may be closed back to the supraspinous ligament. As stated at the beginning, only properly trained, knowledgeable surgeons should implant a Stabilink MIS interlaminar spinal fixation system. Please refer to the Stabilink instructions for use and surgical guide for more detailed information. You can also find more information on our website at www.southernspine.net or call us at 1-478-745-0000. Thank you for considering the use of the Stabilink MIS interlaminar spinal fixation system.